Hi, everyone. Welcome to today's Ontario by Name List Community of Practice call, What We Learned Recent PiT BNL Kickoffs. I'm Chantal Perry, Improvement Advisor with Built for Zero, and I'll be hosting today's session. Also present, I have my colleague Kat Riley and Director of Built for Zero, Marie Morrison. These community of practice calls occur every second Friday from noon until 1 p.m. until the end of 2021, and we started on April 16th. Each community of call practice begins with a presentation from service managers who have volunteered to present on their by name list journey. The remainder of the time is for peer connection, questions, and discussion. We started the year hearing from communities who have been there about their experience developing and implementing a by name list. And in late August, we pivoted to topic-specific community of practice calls. Our next topic on October 29th is about adding to and updating the by name list. If you think of a topic of interest that's not already covered, please connect with your friendly Built for Zero community coach and let us know. Just some quick housekeeping before we get going. This presentation and follow-up questions are being recorded. They will be posted on the by name list resource page under 10 steps to create and use a by name list by Wednesday of next week. If there's questions or things you'd like to talk about during the call, please list them in the chat or raise your hand and we can unmute you. We will have a dedicated Q&A and peer connection time after the presentations. If you want to discuss ideas further, please reach out to your community and speak with your Built for Zero community coach. Please also note that from time to time, senior management from the Ministry of Municipal Affairs and Housing, including folks from the Minister's office, might join in and listen to the calls to learn. This is just a reminder that on our Built for Zero website, under Resources, By Name List, 10 Steps to Create a By Name List, you can find all of our recorded versions and PDF slides of these calls. And I'm happy to let you know that we've posted 2 new pre-recorded webinars to our web resources located on the Built for Zero website under Resources, By Name List, 10 Steps to Create and Use a By Name List. These are titled Adding to and Updating a By Name List and How to Use By Name List Data. So please check these out. I think that these can really help you. Also, just a reminder to let us know if you'd like to be added to and are not already listed in the Ontario By Name List Service Manager contact list. This list can be found in your Ontario By Name List portal. And I think we all know how important peer connection and support can be when we're working towards solving complex issues. I'm super excited to have 2 communities present today, the District of Temiskaming and the District of Parry Sound. Both these communities hosted PiTs with their by name list registry component the week of September 12th, and they're here to share their learnings with us. So up first, I'd like to welcome the District of Temiskaming. Lynn LaBelle is the Housing Services Manager with the District of Temiskaming Social Services Admin Board. So Lynn, I'm just going to stop sharing.
Okay.
And give you some control here. There we go.
So can everybody see my screen?
Not yet. Do you want me to take it back?
Yeah, because it's not working. Sorry.
Okay. There we go. All right.
There we go. Thanks, Chantal. So hello, everybody. My name is Lynn. I'm the Housing Services Manager for the District of Temiskaming. So we are part of Northern Ontario. For anybody who's never been this far, we're about an hour and a half north of North Bay. And we're not as far north as Timmins, so we call it God's country here. So the population for our district, the district that we serve, is just a little over 32,000 people, and that comes from the 2016 census. The geographical area that we cover is approximately 13,299.92 square kilometers. Our district is comprised of 1 city, 4 towns, 17 townships, 1 village, and 2 unorganized areas. The median household income for the district of Temiskaming is approximately $59,630. We do administer CHIPPY at the DSAB, and it is administered through our OW program, One Housing and Community Outreach Coordinator for Homeless Prevention. We only have 1 shelter in the district. Currently, it's a domestic violence shelter, and we have no emergency shelters. So planning for our enumeration, the basics was to learn about enumeration, budgeting, setting dates, creating a home team, which included Ontario Works individuals, outreach worker, and housing staff. So the first step was to get a communication out to our partner agencies. So we sent out a communication earlier on in the year to Indigenous organizations, Canadian Mental Health, Salvation Army, and quite a few more, to let them know that we were planning our enumeration and that we needed their assistance to make it a success. We created the survey and we incorporated Built for Zero resources and coaching support because we wanted to add identifying by name list registry questions in the survey. So volunteer management, we did some recruiting amongst the staff at the DSAB and partner agencies, and we developed some training sessions, schedule, we put in some safety protocols to make sure that all the volunteers that were canvassing the streets on the PiT count were safe. We ensured that all geographical coverage was covered, a lot of the area to cover in a short time period, and the survey locations. Staying people focused, we did some remuneration bags for all the participants, ensuring client comfort and well-being. So these are some of the key partners that helped us out with the enumeration. Some of them participated by having surveys at their locations, but a lot of the staff from these organizations actually were on the street canvassing individuals for the 24-hour period of the PiT count. So we had victim services from both the north and south end of the district, the Salvation Army. We had the local OPP detachments provide extra patrolling on the streets where our volunteers were canvassing. Keepers of the Circle is an Indigenous organization, and they were very helpful canvassing the Indigenous population. And the 1 shelter that we have, the Pavilions Domestic Violence Shelter, also canvassed individuals coming into the shelter. And of course, Canadian Mental Health was a great help with their clients. So what we discovered, homelessness has increased substantially since the last enumeration in 2018. We need additional resources, emergency housing, affordable housing solutions. Homelessness in our community is still largely visible. 62% of the individuals canvassed were couch surfing. More outreach is needed to identify and reach hidden homelessness. There's a large Indigenous representation within homeless population. Further collaboration on population, just trying to get to it on my other screen. Further collaboration and population specific resources and programming. So the next steps, we need to choose an Excel by name list tool from Canadian Alliance, by name list database, and populate the data. I just want to add that we did have 49 completed surveys. So we have 49 homeless individuals in our small communities. All 49 of them consented to be on the by name list. So we will have a good start for our by name list. We need to finalize policies, so data sharing agreements, how to update the by name list, common assessment intake forms. All of these documents are nearing completion. They just need to be tweaked a bit. We are starting small. We only have one community partner on board right now for the by name list. Not to say that we can't add more down the road, but I think it's going to be a good partnership to get us up and running. We need to assess and map out our community housing resources and matching criterias. We need to allocate housing resources and services to by name lists as they become available. Begin matching housing resources and services through by name list priority. We need to continue to educate the community on by name lists and coordinate access homelessness. And we will add community partners as we progress. And that's it for my presentation.
Thanks, Lynn. I know that, you know, I like to call you a one-woman band up there because you take on so many roles and you wear so many hats. So I know how much work that you guys have done and put into this in the last couple of months, and I certainly applaud you. So great work. Next up, we're gonna have the Pamela Nelson, Manager of Housing and Integrated Services, and Kathy Hughes, Community Relations Worker with Homeless Prevention Housing Programs with the District of Parry Sound Social Services Administration Board. Pamela, Kathy, did you want me to share the screen and you can have your slides up, or would you like me to click through?
I'm going to give it a try and see if I can get it to go up.
Okay, here we go.
Just see. It's funny, Lynn, you're going to see some similarities here. Is it coming up?
Yeah, it is coming up.
Okay, let me just see if this, does it show like as though it's in presenter view? Oh, there we go.
Now it is.
Now it is, okay. So funny, we did not have a template, but I can see, Lynn, that you and I've used the same PowerPoint background, which is awesome. So good afternoon, everyone. I'm Pam Nelson. I'm the Manager of Housing and Integrated Services with the District of Social Services Administration Board in Parry Sound. And Kathy Hughes, who is our homelessness team lead, is joining me today. So we're here to talk about Enumeration 2021, who we are. We are a small district that is south of Temiskaming by about 4 hours, but still considered to be in the north. We're 22 municipalities, 6 First Nations. We cover just over 9,300 square kilometers with a population of just over 42,000. Similar to Lynn, we have one domestic violence shelter in the town of Parry Sound, and we do not have any emergency shelters. We rely on local motels and supporting folks through that part of the continuum. Today, currently, we have in our homelessness prevention program, we have 1 case support worker, 4 community relations workers, a team lead, and a supervisor. I say that today as 2 of those positions are only contract, and we're hoping to keep them around because we certainly can see that the housing crisis is changing and becoming more complex. So just a little reflection on what we did in 2018. Kathy will speak to some of the frontline component as to what that was like, and I can speak to a little bit of the preparation to it. We chose to do a period prevalence count in May of 2018, and at that time we were given the choice as to what we wanted to do and how we wanted to do it. And at that time, for the district of Parry Sound, it seemed to be you know, considering the size of our district, this seemed to be the most meaningful way to collect the numbers. We had really engaged community partners. We did a lot of workshops in the community, a lot of training, like in-person training. There was a lot of footwork done, a lot of prep work and policies and time put into making sure that we had covered off our check marks. And we were able to host and partner with our community partners to host a number of community suppers throughout the district, just to be able to engage with as many folks as we possibly could. I'll let Kathy speak to a little bit of the experience for Frontline, and then we can highlight what we did differently in 2021 and what worked, what didn't work.
So in 2018, we had a whole week to do our enumeration. So we went to every municipality office, nurse practitioner's office. We did community dinners. We were out working the streets and just looking for everybody and anybody we could. We learned a lot that whole entire week. We teamed up with Ontario Works to do this enumeration so that we were paired. So there's always two of us. We worked with different people all the time within the agency, and we learned a lot about people being homeless at the time and where they had been staying. And it was really good. We learned a lot. And from that, I think we were able to engage and start on the homeless population of really where they were. But I think this year we took it on even more and got even better at it. But I'll let Pam keep going on that.
So enumeration 2021, we just did it mid-September. Obviously, like everyone else out there, we were doing this in the middle of a global pandemic. So we had to think about things differently as opposed to just going out to do enumeration. It was a PiT count, so we had to cover our large district in one day. So we made sure that we got to our 22 municipalities and that they were engaged. We did do a registry week, the 2 days before and the 2 days after enumeration, just to ensure that we were capturing as many people as we could. We were able to do our survey online this go. So we worked with our IT department to enable all of our community outreach workers to be out in the field with their cell phones, laptops, and iPads so that we could have data coming in live. Also, I think it helped with our data reliability in terms of potential duplication. We do know in 2018 when we teased it out, there was definitely, although our lists were deduplicated, there was certainly the risk of having somebody cross through our survey on more than once. And we did engage with community partners. However, because we were in a pandemic and we are a small community, we didn't have the same. We knew we weren't going to have the same engagement as we did in 2018. And of course, the benefit to 2021 was to have live data coming in. So from the first survey that was completed, we could see the tallies coming through. And that brings us to preparation. So to prepare for 2021, we had really utilized what had happened in 2018. We had a debrief after 2018. We actually were prepared to enumerate in 2020. So we had everything ready to go. And then of course things changed, and so did the structure of what enumeration could look like. We were going from a period prevalence count to a PiT count. We had talked about, if we're going to do this survey, let's ask other questions. What are some other questions that we can put out there? So we did ask this go around, what was your occupation? Are you on the RGI wait list? Do you have a family doctor? It allowed us to have other conversations at the same time. We did talk about vaccinations. We had probably just over 60% of our surveyors, our surveyed people did disclose that they were vaccinated. We had the conversation because we had EMS working with us at the same time, doing sort of their rolling vaccination clinics, which we've had really great experience with in terms of some of our folks who are in encampments with EMS being able to go out and vaccinate. So that was part of how are we going to get to 2021? We continued to have the conversations with our key partners. So food security programs, bylaw, violence against women, CMHA. We utilized our situation table as well. We did several conversations throughout the months leading up to enumeration with our situation table, just to keep their eyes and ears out for folks who would meet the the needs, but also it gave us an opportunity to continue to further educate and promote, our programs within the DSAB, talk about homelessness. What does it mean? What does it look like? We attended a lot of staff meetings virtually. We did a lot of outreach. There was certainly a lot of, as Lynn had mentioned, policies needed to be tweaked because we had to be mindful of, we had safety policies in place in 2018, but we had to meet the criteria for what did COVID look like. So we had PPE packages to share with all of our teams going out into the communities. We had PPE to give out to the people that we were meeting in the community, just trying to get people connected and that sort of thing. We found this go around that our connection to bylaw was going to be very valuable for enumeration, but also moving forward. Some of the things that we learned from that as well, though, is that we know there's a lot more education that needs to be done, because bylaw bringing 20 people who live in a informal, non-winterized trailer park, we don't consider that to be safely, securely, sustainably housed. So there is still a lot of work that we need to do. We had, is there anything I should touch on there, Kathy, before I slip to the next one?
I think you covered a lot of it, but the one thing I really want to stress was that this time around, we started reaching out to community partners long before we did this, like months and ahead. And we made sure that we connected with every food bank that was in our district, and started a relationship working with them. So that not only did we go out and meet them personally through the pandemic, we also stay in touch and continue to meet with them. So we had the food banks working with us very closely. We also developed a strong relationship with bylaw, like Pam said, so they know where people are. We also developed a really strong relationship with working with the Friendship Center in our community and their outreach worker. And we would go out, and we were actually out on the ground in the bush looking for tents, because like everybody else, there's such a shortage of housing right now. We had so many tenters this year. So we were out looking for them and actively trying to see what we could do to help them. And it just gave us a better insight into what was actually going on in our community, and to be able to do the count better, because we knew exactly where we were going that day, because we only had the 24 hours.
So next steps, obviously we're going to review the data and provide the ministry with a report. I'm glad the template came out the other day. We've just been, because we had the data immediately right away, we've been going through and just, filtering things that have caught our interest, like how many, what's the age, what's the, looking at, okay, some of these people, their previous occupations. So there's a lot for us to unravel from this. The data we got is there's a lot of it, and it needs to have some time to unpack it. From there too, we want to be able to meet with our community partners and talk about, one, how was the process? What did we see when we were out on the street? Because of course we were able to survey. So we surveyed 44 absolute homeless, and we observed 43. So we need to talk about that. Where are those 43? Can we get to them? Have we been to them? Is there something that we're missing? And this is where we really identified, okay, we've done a lot of education in our district. It's just, we need to do more. What does that look like? How do we get that information out to people? And part of that too is going to be through the introduction of our by names list as well. We are going to be the holders of the by names list in partnership with our Ontario Works team. And we're working with Ontario Works. They currently use, they have a case management tool that they use for employment that we have started to adapt for our homelessness prevention program. And we actually have the ability to build the by names list into this database. So we're just in early steps of Kathy and her colleagues with Ontario Works. They are implementing some of the folks who've agreed to be on our list. They're starting to input that data just so that we can start to run the reports and check the validity. But it's just going to be a really nice tool that we already have in place, whether you're an Ontario Works caseworker or the community relations worker from homelessness prevention, and then we can extract the data in the back end. It also gives them a really nice tool to be able to highlight, okay, here are my 10 folks on my caseload who are homeless, and then from there too, we can further develop what does our priority list look like, We've talked to our community partners about what this looks like, and absolutely, you know, they're on board to contribute. But we know, I mean, we're the only homelessness prevention program that's funded by MMH in town. So really, our colleagues come to us anyways. So this will give us a nice report as well to be able to sit down. We're thinking bi-weekly or monthly and have conversations about who is still on our list, what does this look like, what actions have been put in place, what's worked, what hasn't. So we're, much like Lynn, we're still working out some of the policies and the processes, but as of today, we can say that our by names list is live, and we are putting people onto it, and we can pull some of the information out. We just don't have quite all of our processes in place to go open with our full Ontario Works team and our homelessness prevention team. So that's really it for us today.
Can I say one more thing, Pam?
For sure, Kathy.
The one thing that I didn't really touch on that I found really made a huge difference for us between 2018 and 21 is that in this year we went electronic. And as a frontline worker, if you're trying to flip paper and try to ask somebody a survey and going through paper, I mean, I've done it. It gets complicated flipping and everything else. And this year when we were able to do it electronically on iPads and on our phones, it was amazing. It was amazing because we could just pull it out. We had hands, like when we weren't using it, we could stick it in our pocket, in our purse, whatever we wanted. It was just easy peasy, and then we just submitted it, and then they got live data, so we weren't duplicating, but it made it so much easier for us not having all that paper, misplacing paper, and just having it in one simple spot. The other thing I wanted to say that was really important is when we did it this year, only being the one day, if you notice on the map that Pam showed of our district, you can see the 2 names for each spot that we kind of cornered off there. Each HPP worker from the Homeless Prevention Program was teamed up with an OW staff member, and they went out. So we were working on establishing or making our relationship grow with OW. We already do have a really strong relationship with OW and work really closely, but this was the day to get to know each other better when you're out on the road and have that time to chat, and we see what each program does again. So that was really important too, and I think it's really important for our by names list for us to keep growing on that relationship as well.
Great, that was excellent. Thank you, Pam and Kathy, for sharing that information. We do have a question from Janice. Curious about what database is your team and Ontario Works sharing for the by name list?
So it's part of Clark Communications. If Jeff is on the line, he would know more about this, but it was a tool that was originally developed amongst our NASDA group to sort of highlight Ontario Works and employment. And so it has, I think they've done some work though for some other sites as well too, like in the South. So it was really developed as a case management tool. So it tracks like their profile, their SAM's information, any connections they have to highlights, you know, do I have my grade 12? What's my field of employment? And then it helps to make connections in terms of what's your best, I don't know if it does the assessment or not to determine like where you're at, whether you're employment ready. And then it allows the opportunity for like the staff to do a blast out to anybody who meets the qualifications for ECE to go to a workshop. And we were able to introduce a tab for our homelessness prevention team because we don't have a case management tool. Now we have a place where we can track our folks and our notes, and then we just ask them, do you think you could do this? And they've been able to so far make it work. We've showed Kat a little bit of it just so she can, you know, we can get her feedback, and that's our next plan, is to be able to pull some of the data to walk through it with Kat just to make sure that we're hitting the mark. But I can always send out more information as to how to connect.
Thank you, Pam. Lynn also supplied that Temiskaming is going to be using the Canadian Alliance BNL Excel workbook. And Marie has a question for both presenters. What was the biggest surprise from the process and or data that you gathered? What really surprised you?
I'll go first, Pam, because you look like you're thinking. For me, the biggest surprise was that everybody who completed a survey consented to be on the by name list. So that tells me that people do want help, you know, like, and they were told before completing the survey that they had the option to complete anonymously or be identified and be put on the by name list to be connected to services. And like 100% of people said yes. So, you know, it makes me feel good that we're implementing this, because I think it's going to be a really good tool for the homeless population.
I would echo that with you, Lynn. I think people were more engaged this time, but I think maybe because we only had that 1 day window as well, some of the conversations were more meaningful, and our numbers look different from 2018. 2018, we had, I think, just over 100 who were absolute homeless. When we think back to it now, it was probably a lot of duplicates, and we just didn't have a good system in place to deduplicate that. This go around, I feel really confident that we probably didn't reach everybody that we should have, but we certainly got folks. There was an engagement, there was a connection made. Our CRWs had, you know, here's my card, here's a conversation. We know who those folks are now. And even with our observed homeless, I think we feel way more confident in being able to go back and say, okay, now we're going to meet with fire prevention, we're going to meet with bylaw, and we're going to do this together, and we're going to go and have those conversations. So I feel like there was just more, it was more engaging for both our staff and the people that we're serving and that we're seeing.
Great. One question I had, I guess, for both of you, what kind of advertising and communications did you use in the community, and what kind of impact do you think that had?
Do you want to go ahead, Pam?
Sure. Like Kathy had mentioned, we did the lead up. I mean, we were prepared to do this in 2020, so we were ready to start talking about it in 2021. So we did a lot of communicating, you know, virtually with our colleagues, but we also used our media platforms, so Facebook, you know, sharing it with our municipalities and doing blast outs like that in terms of what we were doing and why we were doing it. And then we honestly just, any opportunity we had to talk about it, we took that opportunity, and to also highlight that we have by names lists coming and what this is going to mean for us as a community.
Yeah, and I would agree, Pam. We did the same thing. We, you know, we printed some little business cards that talked about the enumeration and are you homeless? And we're going to put them in grocery bags at the grocery store. But then we decided that a better thing was to hand them out to like OPP, paramedics, and they had them a couple weeks before the enumeration. So if they cross paths with somebody, they could give them a card. We had posters everywhere. We used our media platforms. We did a press release to the radio stations. So yeah, and just like you, we were ready to go in 2020 until it was paused. So we had a lot of the legwork done. We just needed to change dates, of course. But yeah, I think pushing the advertising was a big, you know, people recognized it, and they recognized the volunteers, and all our volunteers wore a t-shirt that said Timiskaming counts, and they were easily identified.
Great, thanks for that. Madison is asking, which electronic survey tool software was used in Parry Sound?
So that is a great question. I'm just pulling it up right now. Like, it's through our Microsoft Teams, our Microsoft Office. So because we held the device, it wasn't like a shared, it wasn't SurveyMonkey, but it was through Forms in Outlook, I think is what it is. It's all through Microsoft Teams.
Okay, great. And Marie is asking, how receptive have clients and community partners been to the by name list? Have there been any challenges with that? And how have you been discussing and explaining that?
Again, it's something that, I mean, have been talking about it at our situation table. So at both the frontline and the steering committee table and a number of other groups, I think the way we're communicating it is like, this is a tool that's going to help us, you know, identify who's involved with this person, what steps have we taken, allow us after a certain, you know, after 6 months, we'll be able to look and see, is this somebody who's chronically homeless? Is this somebody who's in and out of the systems? Like, so what can we do differently? Are we putting our resources in the right place? So I think our partners, our community partners like our CMHA, OPP, paramedicine, they're certainly starting to feel the weight of the housing crisis and what homelessness is bringing to their programs as well, not just the DSAB. So I think, you know, there's a lot of excitement in terms of having something a little more concrete, and we've probably been doing it informally for years anyways. It's just now we'll have something with really clear information and clear data. And I think we're holding the tool and taking that responsibility. So really our partners are going to contribute, but it might just be like a template that they email to us, or a conversation that we have and we update the list. So we've got some good, I think, one, we're not putting anything on anybody else right now. So that obviously makes them, you know, there's the buy-in. But I think just where we're at with homelessness, like it's not going away. We need something that's going to be a little more concrete. So I think it's nice to finally have something where we can go, okay, let's see how this works, and let's see what kind of information we get from it.
I reached out to community partners, like the regular ones that, you know, jump on board for enumeration. I didn't have a very big response. I panicked a little bit at the beginning, but in talking about it with my coach, Chantal, it's okay to start small. So I was okay that we only had one community partner that actually confirmed and has been on board and attends meetings and helps develop the policies. But I think once people are more familiar with the by names list and what it can do for them and do for the people in their communities, I think I'm going to see others come on board. Like there's already a few that we've had conversations about it, and I think they will come on board at a later date for sure.
Great, thanks for that. What would you, I guess, is there anything that you would do differently, or any learnings that came out of your most recent enumeration experience? Anything that you could have done differently or you would do differently?
I think there's always something we can probably do differently, or, you know, how do we improve and do this better next time? And one thing that when Kathy and I were preparing for this conversation was like, okay, well, we've learned that, you know, fire prevention's a really good connection for us, and bylaws are a really good connection for us. And we've had great work with some bylaw officers, but we need to continue to do more. Going to the municipal office isn't necessarily what we need to do. It's rather the connections on the ground, like the snowplow operators, and we've had great referrals from them in the past. So, you know, changing the scope of who we're connecting with. Food security is always great to us, and we have a great working relationship, but that's where we know people to go. Whereas some of these other folks, you know, maybe that's where we need to go back to. And that comes back to, like, we've done a really great job of educating our community. We need to do better. There's still more that needs to be done and said, because if people think that couch surfing is housed, then we need to do more.
I think it's more thinking outside of the box too, like for us, because like Lynn, we have such a vast area of bush and crown land that we don't realize who's out there, and they can be there anywhere. So you need to find the connections of people in your community that are seeing those people more than we are. So I think that's something that we would do different, is to start working on our relationships right now with the people that are going to see it. Like Pam said, the snowplow people that are working in the townships. It's not just going to the township office, it's finding the right people to connect with, the bylaw people, the snowplow people, and there's got to be more that see it as well. Like So I think we're going to start working on those connections and get stronger in that area.
I think you're absolutely right. Like, we had people that made referrals to us of, oh, you know, there's people camping out here. And one was a young man that works for the ONR on the train. And he said, I see them every day when we go by. So our volunteers actually walk the tracks, you know, in the bush looking. We didn't find them, but, and the OPP were the same. Like, they told us, oh, if you go under this bridge, if you go behind this building. So we also have to work on those relationships, because those are the people, like you said, that see it every day. So it'd be very helpful.
And part of that, we talked about this too, Kathy and I. Here's the thing, we're so small as a group. What do we do when we get the 20 people in the trailer park that are unwinterized, and one, they don't want to work with us because they don't think that it's a concern? Or what happens if they say, yes, we'd like to work with you? I mean, we don't have an unlimited supply of housing. We've got a couple of little pilot projects on the go, but they certainly aren't going to accommodate the 20 additional people that come out of the bush, plus the other 20 that we actually don't really know about. So there is that worry as well. Who takes that on, and what does that look like in our community?
Great points. There are some questions in the chat. Connor is asking, did you have community partners using the survey software, or did staff go out to all the locations to conduct the surveys?
Yeah, so in-house, we are Ontario Works Homelessness Prevention, and our women's shelter also falls under the DSAB. So we held the devices, and then we partnered with other supports. Mostly it was, we utilized all of our internal resources with case support staff, case workers, homelessness prevention, frontline counselors from the shelter. And then we had some of our other partners just out on the road. If they saw somebody, they would let us know, and that's how we'd reach out to them. So EMS, OPP, CMHA. But we internally held the device so that we didn't have to go into, you know, agreements with other organizations about sharing the software. But also that's what made it, I think that's why IT said we could do it the way we did, by using our Microsoft Teams Outlook program.
Okay. Rhiannon is asking, did your communities need to implement a data sharing agreement with community partners for your by name list and follow-up processes?
Well, we have created the data sharing agreement, and our community partners will have to sign one.
And we're the same. They won't have access to our by names list. We'll do all the implementing ourselves. So we'll just extract what data we can share. So if somebody says they don't want to be on the by names list, but they're part of our HPP program, we'll just filter that out in our report to make sure that that doesn't get shared with anyone else. But we'll have a memorandum of understanding with our community partners in terms of what is being shared and what the expectation is.
Has anything that you guys have both learned from your enumeration experience changed, I guess, the course of what you were planning to do with your by name list implementation? Like, were you hard and set and fast on going in a certain direction for your by name list, and now things have kind of changed because of what you've learned or found out?
I think every week that we join a community of practice call, we go, ooh, that sounds really cool. I like what they did. So we just ebb and flow. I don't know that enumeration was specific to what sort of changed where our end goal is. It definitely looks different from what we started with, but I think like joining these calls has been instrumental for us. We've made some great connections with some other sites that have presented where we've thought, okay, we didn't think of it like that. Let's reshape how we do this. So I think until we're signed, sealed, and delivered, we're going to probably keep changing things a little bit.
And I feel the same. I like these calls have been extremely helpful. You know, when the by names list was introduced at the beginning, I was overwhelmed. I really didn't know what it was all about. And, you know, after seeing all the presentations, and I was quite ready to use a specific Excel spreadsheet until I had a meeting yesterday. And I became convinced that that wasn't the right one for us. So I'm now going to be using the Canadian Alliance one, which is way more suited for what I want in our outcomes and results.
Great. I love that. Everything looks different than where we started from. And it's a learning journey. And every day and every week you get more in your toolbox and it changes the outcome for sure. Wandu is asking, what strategies have you used to minimize the possibility of duplicate counts? I thought I heard that the count was conducted over a week. Please correct me if I'm wrong. Thanks.
In 2018, Perry Sound did their count over a week. And although we had a mechanism in place to not capture the same person, the way that our community events were set up, it's pretty safe to say that we had other community partners doing surveys for us and doing what they thought was best. And for sure, we definitely counted people more than once. This time I feel, no, I think there's no way that we could have been counting the same people, you know, from the top of our district to the bottom of our district. It would have looked very differently. Not to say that it couldn't have happened. We use the same mechanism with our unique identifiers, but definitely feel way more confident this go around with the 24-hour period that we didn't capture anyone twice.
I think we had one that completed a survey twice, but it was caught right away. You know, it's a small town. It's small towns around here, and the staff know people. And when the individual completed the survey in the morning, he was like, "Wow, this is a nice loot bag. I'm going to try this again tonight." But you know, I mean, it's going to happen, and there's nothing you can really do to make it foolproof. But as long as you know that it's a double and you remove them, then your stats are going to be good.
Maria's just made a great point too in the chat that, you know, please raise your hand or unmute yourself and ask questions too. You don't just need to put them in the chat. And yeah, we're curious from others that are on the call today, what stood out for you from the presentations? Anything that you've heard that stands out?
I'll just jump in while people are thinking and looking for their mute buttons. One thing that I really loved is just how you have both leveraged the point in time count to build relationships in your community. We've talked at past calls about how important it's going to be for the smaller communities to leverage those other supports because you don't have as many dedicated homeless services locally. So things like being able to partner with OW and get to build those relationships, get to know more about what each other are doing, or bring bylaw in right from the get-go and clear up the definition so that everyone's using the same language and understands what we mean by homeless. Those things are going to be so valuable, and it's great that you were able to build that into your point in time counts.
Great points there, Kat. I'm not seeing any hands right now. I guess one question I have is there any words of advice at all to your peers who might be enumerating in the coming weeks?
I mean, you just have to go with your planning. There are going to be challenges. Like Pam said, it was a little bit more challenging because we were doing this during a global pandemic, but you learn from it, and you know, there's always going to be room for improvement. So we're going to have a meeting with the committee the steering committee for the enumeration, and we're going to have like a closing meeting, and we're going to make notes and, you know, like comments that I've received emails from a lot of the volunteers saying, you know, maybe next time you should do this. So we're going to jot it all down, and you know, it's really good information, so that next time around you may change the way you do things.
Yeah, I think being open to what comes out of it, and that's those little things. That's your small wins, and that's your okay, what can we do differently next time? So I think that's part of it too. And I mean, certainly we were, you know, did we have everything right? Are we going to do this? Are we going to get the numbers? I mean, you can't overthink that stuff. You're going to get what you get, and then you build from that. And, you know, you embrace the relationships that you make along the way. And I think that was certainly something for us too. Yeah, we got some great numbers and some great data, but we also made some really, we've just, again, further developed that relationship we have with our paramedicine team or the Friendship Center. And, you know, that's time that's invaluable, and you can't necessarily measure that from enumeration, but rather, okay, now I've got this great contact who I can reach out to. So.
Rhiannon, you're unmuted right now if you'd like to share.
Actually, I just wanted to say that one of the things that I wrote down from listening to these presentations was around something as simple, but just, oh, that's such a good idea, about giving out cards to the paramedics, the police, what have you, ahead of the actual PiT count. We just completed ours on Wednesday, so 2 days ago. And we actually were one of the few communities that actually did do ours in 2020. So this was, the 2020 was our federal mandated one, and then this one is the provincial. And I think one of the things that we found, as we did do media releases, we did bring in community partners and what have you, but it was different this time, I found, because the mandate from the province was the entire district. And we have an urban center of North Bay, and then we have small towns, and the district is quite large. And we had always just done something with West Nipissing, as in Sturgeon Falls, and something with East Nipissing, as in Mattawa. And suddenly we were in a position where we had to start reaching out to some of those small municipalities. And that, the idea of doing something as simple as using emergency services seems like such a good idea that I wish I thought of, you know, like a month and a half ago. We did have participation from our smaller areas of the district, but so far it doesn't look like any surveys were actually completed, because we had to use whatever resources were in the communities themselves. It was good in the sense that we started the discussion in those smaller communities, but it really is that whole sense of couch surfing is not homeless. And the hidden homeless are the individuals that we hear about after the fact, when the couch surfing falls apart and all of a sudden they are actively homeless and nobody knows what to do with them. So I just wanted to say thank you for that idea. I wish you had been doing your presentation a month ago so that I could have got that ahead of time. But I do appreciate the fact that it's one of those lessons learned, I think, that we'll add for next year's or the year after's when we do another PiT count ahead. I do think, I'm curious to know what you, and probably what Marie and others, see as being the difference to our PiT counts once the by name list is up and activated and running, and we have coordinated access and process and what have you. Because PiT counts, for me, one of the big differences for this year that we tried to promote was the fact that we really hope we're going to know from now on whether we're counting the same people. Because every other PiT count we've done, or period prevalence count, or all the other enumerations, I have no idea whether the same people were counted year after year after year, because we never identified who the people were. So this time that should change with the advent of the by name list, but I don't know what PiT counts are going to look like after this, and whether we conduct them the same way, or whether we need to use what we've learned from the by name list, or the data that we have, or what have you. I have no idea.
Yeah, Rhiannon, you raise a good point, and it'll be interesting once you know, all the communities in Ontario have by name lists, what direction the province will go in terms of counts. and federally, of course, they would also have to make their own decisions on that. But it does raise a really interesting point. Thank you for sharing that. Anybody else on the call that has done their PiT enumeration in the last couple of weeks that would like to share anything that they learned, any surprises that they encountered, or any tips and tricks for people that will be doing their PiT counts in the coming weeks? Feel free to take yourself off mute or to post in the chat, or if you raise your hand, I can unmute you if you're having trouble. I know, Lynn, that you've only just lightly looked at your data, but you did acknowledge that homelessness has increased in your area, and the population of Indigenous people has increased as well. So it's great that you've already started thinking about the impacts. Pam, have you had a chance to look at your data and make any kind of preliminary, I guess, assessment of kind of what changes you might need to implement in the future?
I think we definitely, we need to have stronger partnerships with our Indigenous communities. There was probably about 50–60% that identified as Indigenous, and I think that's what we've just kind of started to scratch a little bit of it, just to see, what we have. There was some things surprised me, some things didn't. We certainly have, I think, more families this time around than we did in 2018. And unfortunately, that's not a surprise right now with what we've been seeing in our district. The overall numbers too, I think, we look at 2018 and we think, wow, those are big numbers. I feel like this year it's more concrete and we have more information on what their living situation is actually like. And I think that, that will help us sort of really determine what do next steps need to look like. It's bigger than just, what we thought it was. We did ask, so one of our questions that we threw in there was, do you have a doctor? Because we just assumed that everybody in our homelessness population did not have a doctor. 90% have a family physician. So then that makes us want to say, okay, we should have asked a further question. Can you reach them? Can you see them? What does that look like? One of a pilot project we're doing in Parry Sound is a motel project, and we have a nurse practitioner that's working in partnership with us, and we utilize her 3 or 4 times a month to do some virtual non-urgent care for us. And it just surprises me that, okay, of the 44 people we surveyed, 90% of them have a family doctor, yet they identified as having significant mental health and addiction related barriers and physical limitations. So now we have a different question to take forward to our healthcare partners to say, here's what we can see. There's something that's missing. What is that? How do we figure that out? And maybe that changes what we do next time for enumeration, or what we do with our by names list. Maybe we ask some further questions to make some of those links.
Right. Lynn, anything you wanted to add on what?
No, I totally agree with Pam. I mean, people will tell you stuff. I wish we would have thought about asking the questions about the vaccine and stuff. I've made notes, and that's what these calls are all about. We pick up on tips for the next time. So
great. Well, thank you very much, Pam, Kathy, and Lynn, for joining us today and sharing your journey. So I hope that it helped other communities. So, all right, thank you everybody for joining us today, and we'll see you again at the next Community of Practice call on October 29th.
Thanks, everyone.